This topic is about physician burnout.
Okay.
And so this is a real thing. I haven't really followed this a whole lot, but I happened to be flipping through articles this past week, and there was a new survey that came out from 2022, and it's the Physician Foundation's 2022 Survey of American Physicians. And it was specifically, this one was looking at overall physicians' well-being. And in quotes at the beginning of the study, it says, "State of physician well-being is low," which I thought was kind of humorous. I mean, not humorous, I mean, it's kind of sad, but I mean, that was like literally the first thing that it said. And so this survey looked at all the physicians and asked them questions, and it reported the results. And so I'm going to go over some of these statistics. 60% of physicians, and this is from just last year, have inappropriate feelings of anger, tearfulness, and anxiety. I thought that was super high, 60%.
What does that mean, inappropriate feelings?
Well, for example, I guess it means if,
what?
like, say your dog dies and you get sad about it, that would be appropriate, tearfulness. But like if you're feeling these things when you really shouldn't,
okay.
That's a good question. But it is pertaining to their jobs. These are questions about being a physician. So I guess like if you have
not caring when they should be caring.
Well, maybe for example, like if you had a patient die and you get upset about that, I mean that's appropriate.
Yeah.
But if like you just randomly feel very sad about your job, I mean that's probably inappropriate. So.
Okay, cool. I was like, what does that mean?
That's a good question. Well, and that's great. Thank you for asking that question because I kind of like read into that. I was like, okay, that sounds legitimate, but probably a lot of people didn't. So thank you for asking. 1/3 of physicians felt hopeless. That's pretty crazy. I mean, 1/3 of physicians feel hopeless. 60% report burnout. Pretty high, and all of these numbers are higher. What made this study or this survey noteworthy is all these numbers are worse. Of course, COVID's playing into that. We'll talk about why these things are. 80% of physicians feel that there's a bad stigma to seek mental health for themselves, which I think that's very reasonable. It's almost like physicians are held to this very high standard, and so physicians say that they're depressed and they go seek out mental health for that. I think that potentially some people might see that as a negative, like, oh, this doctor's about to crack or whatever, I don't want them treating me.
Yeah.
And so I think that that's potentially limiting some physicians.
It's not like they have to they don't have, a physician doesn't have to give that information to the hospital that they're working at.
No,
right?
of course, I mean, that's patient confidentiality.
Yeah.
They don't have to say that stuff. But I mean, I think
maybe
there's always the
them
worry that
feel weaker, not as
or maybe someone will find out,
Yeah.
Also, there's a significant decrease in how physicians feel supported by their colleagues, hospitals, and practices.
Okay.
That's pretty crazy. More physicians feel like that they're on their own. And also what's interesting is this study found that there's more physicians who are younger are having these negative kind of feelings versus older, which is kind of interesting. I want to talk about that.
I wonder if there's a plateau where it's you start feeling like if an older doctor comes in oh yeah, I had those feelings when I was your age, and then at this age is whenever I started being this is what it is.
Based on the age breakdown, I'm on the older side of it. Barely, it was 45 was the age. They looked at physicians younger than 45 and ones older than 45. I don't know this for fact. My kind of feeling on that is there has been a change in residency programs in the past 20 years. Residency for physicians used to be similar to joining the military. It was very hard, very stressful. I mean, people would crack all the time, and then what ended up happening is they felt like residents were potentially, harming patients because they were overworked, and so some laws went into effect to limit how hard a resident could be worked. And so I do think that may play into it. I don't know that for a fact. It's just kind of an opinion piece. Because when I went through residency, it was literally the worst time in my entire life. It was so hard. I was got clinically depressed during it. Yeah. I was just a shambles mess.
Yeah, the only thing I have to relate to that is watching Scrubs.
No.
Because at the beginning of that show, they're in residency at that hospital
Man,
with
it's
that
so
crazy
funny.
doctor.
I literally was a surgical resident when the show, what's the show about the surgical residents? I mean, it's Travis, help me out. What's the show about surgery residents?
It's not ER or...
No.
Grey's Anatomy.
Yeah,
Grey's Anatomy, that's it,
Okay.
Grey's Anatomy. So that show literally that show's about surgery residents. It literally came out when I was a surgery resident. And I watched one episode and I was like, this is total garbage. Like, it was so far from reality. Like,
Well, I mean, Scrubs was a
Scrubs
comedy,
was a comedy, right?
so
But-
it's supposed to be silly.
But Grey's Anatomy was supposed to be kind of like real life, and it was a
Yeah.
total joke. I mean, we were just worked to death. Like, we didn't have time to sit around and hang out and talk. I just remember watching the episode, and they were all sitting around talking. I was like, why aren't they working? Like, what are they doing? Why aren't people yelling at them?
I'm like, aren't they having affairs too?
Yeah, exactly.
All of
Like,
them
what's-
are having affairs.
What's
with
going
each
on?
other.
And so, I wonder if that plays into it, because when I got out of residency and I got into like fellowship and then into private practice, I mean, I was working a lot, but and there was some stress associated with it, but compared to what I had to go through in residency, it was definitely a dramatic improvement. And I'm wondering now that the residencies are much easier, and they are without question much easier than they used to be, if it's kind of inverse where, residency is a little bit easier, then you get into private practice and you're actually responsible for doing things and you're having to work harder than you did when you were
I
in
could
training.
see that.
I feel like that probably is playing some role in this, although this study didn't talk about that. But it did talk about some of the reasons why physicians were having burnout, and it talked about that there's an increase in low-value work. So, for example, like paperwork kind of things, it has gotten pretty oppressive. When I first started practicing, there wasn't near as much busy work or paperwork that you had to do, and now it's just endless.
Yeah.
There's decreased flexibility and autonomy, which is a huge thing, and one of my biggest gripes about medicine in general. When I was a medical student, most physicians were employed by themselves or in small groups. Nowadays, that is like the very, very minimum of what is reality.
Mm-hmm.
Nowadays, most physicians either work for a hospital, a university, or they're in very large physician groups. I'm a solo practitioner, and I own my own business. That is almost unheard of these days for physicians. It's just not a thing. And it's great for me because I have total autonomy. I mean, nobody can tell me what to do, which is nice, right? I mean, you're your own boss.
Yeah.
But when you're an employee, you don't have that. Dealing with insurance was also stated as being a problem. I mean, I've talked about that ad nauseum, that insurance companies are literally the worst. I mean, I still do insurance cases because I want to do cases that help people, and cosmetics is not, I mean, cosmetic does help people, aesthetic surgeries, but I want to do the cases that change, people's lives in
Yeah.
other ways.
Yeah.
And so I still have to do insurance cases, and I have to deal with insurance companies, and I do hate it. I mean, they're big bureaucratic, entities that, in my opinion, don't always put the patient's well-being first.
Right.
And I think that is weighing on physicians. And then lastly, the business aspects, which that's become a little bit less of an issue because so many people now are employees. But I know for me, that's probably one of the biggest things. I mean, I'm trying to run a business here. And so, you have to almost have this dual knowledge base of medicine and business
Yeah.
to kind of keep it running. And you know about that. Yeah. So why is all this important? I mean, obviously we care about doctors. We want doctors to be around because they are taking care of us. But why is it really, really important? Well, burnout can lead to some potential bad outcomes.
Yeah.
And there's been some studies on this. It showed that burnout physicians are more likely to have medical errors. It's more likely to have decreased patient satisfaction.
Mm-hmm.
It can negatively affect the mental health of the patients because the physician's burned out. They may not have the empathy and connection that another physician might. And there is also an increased incidence of burned out physicians ordering needless tests and procedures, which overall increases costs and decreases quality of care. So, I mean, this is kind of an important thing. We're seeing a trend of physicians getting worse and worse off mentally due to all these various reasons. And I mean, I don't want to say it's a public health crisis, but I mean, it is worth talking about how can we make this better so that we're not having bad outcomes in medicine.
Yeah, I wonder if there's since you said that a lot of doctors are employed by hospitals and universities, I wonder if any of those
have mental health well-being kind of people,
like HR development.
That's
for
an
those
amazing
types of
question.
things.
I have no idea because I'm not employed by anyone.
Yeah.
I don't hear people talking about it, so I'm kind of thinking the answer to that question is no, but I am going to actually do some research on that. I'll ask. I work with the anesthesia group that's hundreds large, so like they're a really big group. I'm going to ask some of my colleagues about that, and I'll ask some people at the hospital.
Yeah.
That's a great question, and
like Texas Health is like a huge.
Yeah, I work at Texas Health.
Yeah.
I work at 2 of those.
So it's like I wonder if they have any type of like.
I'm pretty sure the answer is no, because I am on medical executive committee for THR for one of the surgery centers, and I don't ever hear anyone talking about that.
Yeah.
So I kind of think the answer to that's no, but I mean that's a great suggestion.
They have those at corporations for
You're right.
regular employees.
You know, that is a great suggestion, and maybe that's something, you know, that should be considered as kind of a standard of practice for big groups, is to have somebody to kind of watch the overall well-being of physicians.
Yeah.
So
We
lastly,
need to take care of them.
that's right. You got to take care of. Well, and so last thing I want to do is talk about how potentially patients could protect themselves. You know, because I'm not saying that there's patients out there dying from burned out physicians, but I mean the studies do kind of show that outcomes do suffer a bit if someone's burned out. So I kind of was thinking about, you know, how could you just not put yourself in a situation where that might happen to you. I think it is important to do research, you know, looking at things like credentials, experience, reputation, you know, online reviews. I mean, online reviews are kind of hot, cold because, you know, you can manipulate those. But I do think that it's important to look at them. You know, if you go into an online review and you see things like, oh, patient, you know, doctor didn't really listen to me. I mean, that's a little bit of a red flag. And I say that with a grain of salt because, you know, a lot of times people will go and say negative stuff, and you'll have 10 people that are happy that don't leave a review. But it gives you at least some barometer of how that physician might be doing. And you know, look at like current reviews.
Do you have like a site that's like the most reliable?
Google reviews. I mean, the funny thing is there's like a bazillion sites reviewing doctors. The only one we really care about.
To find a doctor is if you put like MD next to, you know,
Yeah.
It's just really easy to find it.
The one that I, in my personal practice, look at is Google reviews because and that's because most people looking for a plastic surgeon are using Google.
Okay.
And so I'm most concerned about our Google reviews, which actually are pretty great.
Holla.
No, I'm looking. I look at those because of that's where most people are searching for me.
Right.
You know, there's things like health grades.
I depend on Google
Yelp.
reviews.
Yeah,
my
right.
Business,
Yeah. So you can get into like a quagmire because there's one that I don't even know which one it is, and I have like 2 reviews and like one's bad, so it's like I had like one star, 1 5-star, and so it's like I have a 2.5 stars. But I mean, it's only 2 reviews, so you know, do I really like think that that's important? No, not really. But you know, look at the ones where people have like 50 reviews. I think our Google is like 60. I don't know. It's a lot.
Yeah.
So the other thing is good communication. You know, and we just talked about this in the last segment. You know, having good communication with a doctor is going to lead to better outcomes. And so make sure that your physician understands your symptoms. You know, addresses your concerns. Don't be afraid to ask questions. You know, ask them what their thoughts are on things. You know, if they're not interacting with you, then you know that could be a potential problem.
Yeah.
And be an active participant in your care. You know, I always tell patients that when we set up these plans of care, and this goes a lot when I'm doing like the wound reconstruction stuff, I need patients to be involved, like to be looking out for themselves, doing the things that we're talking about. And then the lastly is don't be afraid to get a second opinion. You know, if you have a doctor and you don't feel like they're addressing your needs, get a second opinion. We talked about that last time. I mean, it's important, and I don't think that it's you know, I think some doctors might be offended by that. I personally don't think.
I mean, honestly, like thinking about it, it's like I wonder if in that situation that happened like 10 years ago, not anything to do with plastic surgery.
Yeah.
But I wonder if I was just ignorant to life at that point.
Right. You were
so
young.
It's like, I was just like, I depended so much on,
Right.
like even I just was like, doctors are always right, you know, in my head.
Yeah.
So it's like maybe like if that happened to me now, I wonder if I would, you know, get a second opinion. Like I know that this is wrong.
Something's wrong.
Yeah.
Well, I think probably the biggest take home from this segment, honestly, I think that what you stated is probably the most important thing, that maybe we should consider, you know, these hospitals, big physician groups have somebody in their HR department that's
like dedicated to like
doctors, you know, mental health. Because clearly the data is showing that doctors are suffering a bit. And not to say, oh, poor doctors. I mean, but it is a stressful job.
Like it's like a work satisfaction program for doctors.
Yeah. Because at the end of the day, when physicians are in a good frame of mind, like that's only going to improve patient outcomes.
Yeah, with everything.